Hi, my name is Dr. Caceres. I am the director of the Enhanced External Counterpulsation Therapy at Buena Park Heart Center. Today, I would like to talk to you briefly about coronary artery disease and the role that Enhanced External Counterpulsation, or EECP for short, plays in the treatment of coronary artery disease. Coronary artery disease, or CAD, is the hardening of the coronary arteries over the years as a result of high cholesterol, high blood pressure, high blood sugar diabetes, smoking, family history, and other factors. Heart disease is the leading cause of death for both men and women above age 40 in the United States. About 610,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. Coronary heart disease is the most common type of heart disease, killing over 370,000 people annually. Every year, about 735,000 Americans have a heart attack. In the United States, someone has a coronary event every 34 seconds, and an American will die of such an event every 84 seconds. The problem with coronary artery disease is that most of the patients don't have any symptoms. Some patients develop chest discomfort. Other patients develop angina pectoris, which is the substernal chest discomfort associated with exertion of mental or emotional stress relieved by rest or nitroglycerin. Other patients develop shortness of breath, indigestion, heart attack, or even sudden death. So the diagnosis of coronary artery disease is basically done by a physician as he encounters an abnormal stress echocardiogram in those patients able to walk in the treadmill, or perform a myocardial perfusion imaging study such as the PET scan, and confirmed by a selected picture of the coronary arteries. This is the coronary angiography in the cath lab in a hospital. So we have a patient, for example, who is 68-year-old male with history of hypertension, high cholesterol, and diabetes, and over the years develops coronary artery disease. When we see his pictures in the cath lab, we can see a severe blockage in the 3 arteries of the heart and also in the left main coronary artery. The treatment of coronary artery disease involves the use of medication. This is optimal medical therapy for those patients with symptomatic coronary artery disease, angioplasty with a stent, coronary artery bypass grafting surgery, and enhanced external counterpulsation. In coronary angioplasty, a guide wire with a deflated balloon is passed through the catheter in the narrow artery. The balloon is then inflated to open the narrow artery, and the stent expands around the balloon. The balloon is removed, and the stent is left in place to keep the artery open. In the coronary artery bypass grafting surgery, we use saphenous vein graft and the left internal mammary artery graft, for example. The problem is that more than 2.5 million patients with symptomatic coronary artery disease are not amenable to coronary angioplasty with a stent or coronary artery bypass grafting surgeries for multiple reasons. And about 1.8 million have refractory angina pectoris. This is angina pectoris despite of medical therapy and or revascularization with angioplasty or coronary artery bypass grafting surgery. So in these patients, enhanced external counterpulsation is very well indicated, as we have recently shown in our article published in January about enhanced external counterpulsation as a unique treatment for the no-option refractory angina patient. So the question is, what is enhanced external counterpulsation? What is EECP? EECP is a unique treatment to improve the blood circulation to the heart muscle. It provides a squeeze to the lower extremities, pushing the blood toward the heart. Increases the blood flow to the coronary arteries and oxygen delivery in the myocardium. EECP opens the blood vessels of the heart, which are partially blocked, and develops new functional collateral vessels, increasing blood and oxygen to the heart. EECP increases the cardiac output, resulting in better blood supply to all organs and tissue of the body. So the beneficial effects are not only for the heart, but also for all the organs such as the brain, the kidneys, the lungs, and the skeletal muscles. So the equipment of the EECP therapy involves the pneumatic cuffs resembling oversized blood pressure cuffs, which are wrapped around the legs, the lower thighs, and the upper thighs, including the buttocks. As we have seen in the article that we published recently, the inflation and deflation of the pneumatic cuffs is timed to the patient's heartbeats and the electrocardiogram. So inflation occurs after each heartbeat during diastole, when the heart relaxes, providing a squeeze to the lower extremity, pushing the blood towards the heart. So the inflation starts at the legs. Once the inflation takes place on the legs, 50 milliseconds later, the inflation takes place in the thighs. 50 milliseconds later, in the lower buttocks. This allows the blood flow going all the way back to the heart and open those partially blocked coronary arteries, as well as those small vessels that we cannot see with the naked eye. Now, deflation occurs during the next heartbeat, during systole. When the heart is squeezed, the pneumatic cuffs simultaneously deflated before the contraction of the heart allows the blood flow coming from the heart to the lower extremity to flow freely in the lower extremity and other parts of the body. As we recently published in the Journal of Clinical Pharmacy and Therapeutics in January 2021, our article of Enhanced External Counterpulsation as a unique treatment for the no-option refractory angina patient, the inflation and deflation of the pneumatic cuffs is timed to the patient's heartbeats and the electrocardiogram. Inflation occurs after each heartbeat during diastole when the heart relaxes, providing a squeeze to the lower extremities, pushing the blood toward the heart. As you can see in Figure 1, the inflation starts in the legs, and from there, 50 milliseconds later, the pneumatic cuffs at the thighs are inflated. This is Figure 1b, and the inflation is sequentially continued to the lower buttocks 50 milliseconds later. This allows the pushing of the blood back to the heart muscle, opening the coronary arteries, which are partially blocked. Now, the deflation occurs during systole, before the next heartbeat during systole, before the contraction of the heart. And this you can see in the Figure 1, letter D, simultaneous deflation allowing the decreased resistance of the vessels and the circulation going back to different parts of the body as the heart squeezes the blood during systole through the aorta. Now, in this diagram, in Figure number 2, you can see on your left the 3 heartbeats in the electrocardiogram in a patient who is not under the ECP therapy. So you can see the systole and the diastole, as the diastole is seen as a one single hump. Now, on your right, the last 3 bits depicts the electrocardiogram and the sphygmomanometer. I make a mistake there. I just repeat. Yeah. On the right hand, you can see the patient with enhanced external counterpulsation. In the last 3 bits, we have the traces of the electrocardiogram as well as the traces during systole and diastole of a patient with enhanced external counterpulsation. Notice that the systole has decreased, but in diastole we have 2 humps, a small hump and a high second hump during diastole. This second hump means the diastolic augmentation, which translates in an increase of the coronary blood flow and increase in the coronary perfusion pressure. And this has been very well documented in all the patients who receive the enhanced external counterpulsation. Now, this inflation and deflation takes place during 1 hour, and the whole therapy is 35 hours. At the present time, the current patient population receiving ECP therapy according to the CMS are those patients with symptomatic coronary artery disease responding inadequately to medical therapy. Those who are poor candidates for angioplasty or coronary artery bypass grafting surgery, or those patients who continue to have symptoms despite of angioplasty or bypass surgery, as we have clearly mentioned in indications for EECP therapy in our article published again in January of 2021. However, the benefits of ECP therapy are not only for the heart. It has been used in other medical conditions such as coronary artery disease without plaques, disease with a spasm, restless leg syndrome, renal insufficiency or failure, stroke or transient ischemic attacks, this is TIAs, aortic valve stenosis, erectile dysfunction, and diabetes mellitus, especially the effect of the ECP in the microcirculation and microischemia. So, ECP therapy is usually given for 1 hour a day, 5 days a week, Monday to Friday, for 7 weeks, a total of 35 treatments, as it was approved from the initial study published in 1999 by Rohit Arora and colleagues. ECP therapy is a 35-session commitment to improve your heart condition. ECP therapy is covered by Medicare and most of the healthcare plans. Some people ask me, how long have you been doing ECP at Buena Park Heart Center? We have more than 13 years of experience since ECP therapy started in 2007. We have helped more than 900 patients with this remarkable therapy. Most of our patients started to feel better by the 2nd week of therapy, and we are committed to provide this proven and effective treatment modality with many benefits for our patients with heart disease. In summary, ECP is an effective and safe treatment for patients with coronary artery disease and or heart failure. ECP is an alternative therapy to coronary angioplasty with a stent or coronary artery bypass grafting surgery, and ECP reduces symptoms of angina, medication use, increases energy, and exercise tolerance. At Buena Park Heart Center, we have a state-of-the-art facility with 21 ECP treatment beds, 21 dressing rooms, 7 bathrooms, 20 high-definition televisions and earphones for individual use, and 6 EECP certified therapies. So, At Buena Park Heart Center, we have the program Enhanced External Counterpulsation, in which patients and health professionals are working together to maintain a vigorously pumping heart. Thank you.